Mr. Yangishev for services to the resettlement of refugees.
I'm Jack Shear. I'm the Director of Vietnamese Mental Health Service. Our service is mainly mental health focused for almost 35 years. We have provided service to more than 1,000 Vietnamese individuals. Mental health in Vietnamese, there's no similar word. It was a huge stigma in the community. We also run things like day center that people can come together, make new friends, meet those who have the similar issue so they can share the experience. On the other hand, also support people and reduce their isolation. We also running a lot of workshops to raising awareness about well-being. Many cases refer to our service are people who have more severe mental health problems and have been diagnosed by psychiatrists as having schizophrenia. The family don't understand how the mental health care system in this country works. So we will then support the family, go into hospital, visit the patient there, make sure that their concern can express to the psychiatrist. 90% we rely on contract with NSS. They decided to carry out a proper review of our contract. But at the end of the review, they decide to terminate our contract. This is a huge loss, not only for them, but also for the Vietnamese community as well, because they won't find anything similar to support the Vietnamese community.
So I'm Lily and I'm a clinical psychologist, and also at the moment I'm chair of the Vietnamese Mental Health Service, and I joined the organisation in 2018 as a trustee. As sad as it is that the organisation is closing, you know, there is still going to be a need, and I always think when we were taught as psychologists, with every ending is a beginning and with every beginning there's an end. They're kind of two things are the same, and my hope is that this will give birth to something really great for, you know, learning from the work that Jack and the team have done over the years and building on that for future generations where needs of the community are met in more creative and innovative ways.
My name's Angela Byrne. I'm a clinical psychologist. I'm also a member of the management committee. The biggest kind of leaps forward in our thinking was when we did the Recipes of Life project. The place where people really came alive and were full of energy and enthusiasm was in the community kitchen. The group wanted to make a recipe for coping with homesickness when you're a refugee. And they talked about what kind of ingredients would be in a recipe like that. And it was things like, you know, Vietnamese values and passing those on to your children. One of the really significant projects that I was involved with was the Vietnamese Voice Conference in 2009. Vietnamese people were often rendered invisible and voiceless in mainstream services. We wanted to redress that, and we wanted to find a way to kind of elevate Vietnamese people's voices within the, you know, mainstream services. The impact of VMHS is huge for a small organisation. I've seen people come to the service in real crisis, you know, feeling suicidal, feeling hopeless, feeling scared, really scared about, you know, the situation they find themselves in. And then over the years, you know, kind of really recover from some of those problems and go on to live the lives they really wanted to.
Tôi tên là Bùi Ngọc Hùng. Tôi đến đây nhờ sự giúp đỡ của Hội Tâm Thần. Tôi đến đây học tiếng Anh, giao lưu với bạn bè, học làm thủ công, học vẽ tranh, học làm chụp hình. Tôi thường gặp bác sĩ tâm thần. Họ nói tôi ăn uống những đồ tốt, cố học một vài chữ tiếng Anh, rồi đến giao lưu gặp bạn bè, đến đây cho nó thoải mái trong đầu, đỡ cho nó căng thẳng, thần kinh nó bớt căng thẳng.
Tôi tên là Nguyễn Thủy Tiên, tư vấn tâm lý ở trung tâm Mental Health Service, Vietnamese Mental Health Services. Thì ở đây thì tôi có làm việc thì cả hai ngôn ngữ, vừa tiếng Việt tiếng Anh. Thường đến tư vấn tâm lý thì thường hay xin lời khuyên, nhưng mà trong tư vấn tâm lý thì không có phải là sao lời khuyên như vậy, là một cái chỗ mà an toàn.
My name is Phương Thanh. I have been working as the bilingual counselling for the last 6 years. At the beginning, we worked face to face and only focused on the Vietnamese community in London. And then because of COVID, it forced me to change the way of working. At the beginning, I'm very worried about, you know, the non-face-to-face counselling, whether it worked for Vietnamese. But because of COVID, so I tried, and actually it's worked. It worked really well, and it opened our door to everyone. Open our door to the referral from the. So that's the reason we got a lot of our waiting list is quite long, sometimes 6 months. I find the pleasure to working as the bilingual counsellor, and I find it really rewarding, and I feel, you know, it's very, it's even though the journey very tough, but I find, you know, the Vietnamese Mental Health Service give me the opportunity to work as the counsellor. So I'm quite grateful for that.
Hi, I'm Dr. Nick Bass. I'm a psychiatrist by training, and I've worked for many years at East London NHS Foundation Trust. When we have encountered people of Vietnamese heritage with severe mental health problems, the VMHS has been extremely quick to respond and come and support, whether still in hospital or for their longer term. One of the most impressive things that I recall VMHS providing over the years is that they had a small supported placement for about 6 patients at the time. This was aimed at providing community care for young men with the most severe mental health problems. It was a community group home designed to provide exactly that care, so somewhere between hospital and individual independent living, but to enable longer term recovery, and but within a safe, culturally and linguistically appropriate setting as well. And I think that enabled them to recover better, to move on more readily, and to develop confidence, but also practical day-to-day living skills against the very difficult background of a very disabling illness.
Hello, I'm Dr. Wei Huang. I'm a public health specialist and health services researcher. I was chair of the VMHS between 2006 and 2022, approximately 15 years. One of the projects I was very proud to be involved in was a book called Southern Medicine for Southern People by Lawrence Monnis and Michelle Thompson, both historians of history of medicine. This was when I was in the US. I met these very interesting historians and I talked to them about the VMHS, and they invited me to, and Jack and the VMHS, to submit a chapter to their book. So that it puts the VMHS and the services that we provide to the diasporic community in the UK in the context of the development of the history of medicine in Vietnam and further abroad.
Selena, I remember the first day when we started the project initially, so I was there right from the beginning, and I saw the gradual development and how it proved to be most important, and how all the activities develop, and it got great also interest and great fun also working together with Jack and the management committee. So it's sad that it has to come to an end, but it was a good work achieved over more than a quarter of a century, and we can only be grateful to the British government and the local authorities that we have been able to do so much for those in need.
I'm Carol, I'm a photographer. I create collective experiences where time and memory and light come into play. I got involved with the Vietnamese Mental Health Services in 2019 for the project Light Conversations. Every week during 9 weeks, we collectively transformed the office into a pop-up photographic darkroom and went out to take images, sometimes even under the rain, with the pinhole cameras that we built ourselves to explore what we can do with light and in the surroundings of VMHS. Some of us decided to take the camera home to capture more intimate spaces. We paid particular attention to what we could see, hear, and feel in the present moment. We wanted to capture something of self-interest, to share stories, our stories, without forcing anything. In both written and spoken words, in Vietnamese and English languages, we expressed some of our findings.
Tên là Hương, tôi đến với cộng đồng người Việt này được 1 năm. Rất là xúc động, rất là buồn khi cộng đồng đóng cửa. Cảm ơn tất cả những người đã giúp cho cộng đồng, những người làm việc ở đây với tấm lòng rất là tốt lành. Như chú Trác, Thủy Tiên, cô Mai, cô Mỹ, chú Lâm là những anh chị đã giúp cho những người Việt ở đây đến. Tôi dẫn một người bạn mất trí tới đây mỗi thứ năm để làm những đồ thủ công như là làm thiệp, làm hoa vải và làm những sâu chuỗi. Khi nghe tin như cộng đồng mất như vậy, đóng cửa lại thì trong tôi có nỗi niềm rất là buồn. Vì thật sự biết được cái cộng đồng này quá trễ, và trong bản thân mình cũng có một cái sự muốn liên kết để mà giúp, cần sự giúp đỡ cũng như là mình có khả năng để giúp những người khác, nhất là những người Việt của mình, người lớn tuổi, họ cô đơn, họ mất trí, và nơi đây là một cái sự sinh hoạt nối kết. Thì thôi tất cả nói lời tạm biệt thì cầu chúc mọi người được mạnh khỏe và hy vọng có những cái nơi để mình tụ họp, sinh hoạt nhau. Cảm ơn tất cả.
Thay mặt tất cả anh chị em ở trong hội, gửi lời cảm ơn đến, trước tiên là đến chính phủ và các nhà tài trợ để giúp đỡ một cái cộng đồng tốt nhất như thế này. Và cũng cảm ơn với tất cả những người mà đã làm việc ở đây, và tất cả những người đã làm việc ở đây rất là nhiệt tình, rất là tuyệt vời, trên cả tuyệt vời, khi chúng tôi đang bị rất là nhiều stress, trầm cảm, rồi đến đây được gặp mọi người, nói chuyện để giúp đỡ, rồi chia sẻ trong cuộc sống, trên cả tuyệt vời, amazing. Thay mặt tất cả anh em trong hội, thank you very much.
Cháu xin cảm ơn chú Trác và toàn thể nhân viên ở trong Hội Tâm thần Việt Nam đã 30 năm đã giúp đỡ cháu và các bạn người Việt Nam và đồng hương người Việt Nam rất nhiều, và kính chúc chú Trác và các toàn thể nhân viên một cuộc sống vui vẻ và mọi điều tốt đẹp nhất trong đời.
Cái ngu mày ngủ cho lâu, mẹ mày đi cấy đồng sâu chưa về. Bắt được con chấm con chê, cầm cố lôi về cho cái ngu nó ăn. Cái ngu mày ngủ cho lâu, mẹ mày đi cấy đồng sâu chưa về. Bắt được con chấm con chê, cầm cố lôi về cho cái ngu nó ăn.